For this week is the family, Neisseria, and related organisms. So this is our fourth topic for midterms, okay? So our objectives or learning outcomes for this topic is that at the end of the discussion, you are equipped with the knowledge of how to culture, how to identify these organisms, for you to be familiar with the methods of identification in order for us to identify them in the laboratory, and also for you to be able to create a schematic diagram of the algorithm of the methods of identification for this group of organisms. Of Neisseria as a group, they are aerobic, non-motile, no spores formed, and they are gram-negative diplococci. Okay? So, dalawang pares ng coccal organisms with one end that's flattened. The ends that are adjacent to each other are flattened. So, they look like capital letter D na pinagdikit. Okay? So, yung flat ends nila, yun yung magkadikit. That's why they are described as coffee beans or kidney beans shape. Okay? With the exception of Neisseria weaveri, Neisseria elongata, Neisseria bacilliformis, because they appear to be bacilli or rod-shaped in form. Okay? Now, in addition to their microscopic characteristics, biochemical characteristics, biochemical reactions of our Neisseria include catalase and cytochrome oxidase test, wherein they are positive for both, with the exception of Neisseria elongata subspecies nitroreducens and bacilliformis. So ito si nitroreducens and bacilliformis is catalase and cytochrome oxidase negative. Now, aside from those characteristics, we know that our Neisseria are capnophilic, meaning they would require increased carbon dioxide for growth. Somewhere between 3 to 10% carbon dioxide would do. You can opt to use the candle jar, pinakakaraan na gini siya na style, guys, na abtantan ako ni buyag. And then, eto yung carbon dioxide gen compact. Okay, we call this the gas pack during our time. It's a brand name, gas pack. And then, you can place about 10 to 15 plates here. So, pwede. And then, carbon dioxide biobags, pwede rin. And then, if kaya rin with kaayo, sister, pwede naman, magbili na lang ng carbon dioxide incubator. Okay? So, the best temperature for our Neisseria is somewhere between 35 to 37 degrees Celsius, which is common in mesophiles, right? Yung ating mga yung common in pathogenic organisms. So highly pathogenic man gini sila. So mo ginilang temperature for growth. Okay, so ang primary pathogen natin ay walang iba kundi sina Neisseria gonorrhoeae or the gonococcus and Neisseria meningitis or the meningococcus. Okay, so they are commonly isolated in mucous membranes of our respiratory tract. Okay, or mas common sa urogenital tract and sometimes sa anus pwede rin naman. Okay. So, again, gonococcus or gonococci, si Neisseria gonorrhoeae, meningococcus or meningococci naman si Neisseria meningitis. Okay? So, they are highly fastidious, which would mean na daghan kay silang arte, kailangan nila ng additional na mga nutrients para maganda yung tubo nila. So, they would require enriched media, enriched with iron, blood components, like say for example, Neisseria gonorrhoeae, it grows well on enriched chocolate agar plate na meron dapat supplement na cysteine, okay? The X factor or hemin, the V factor or NAD, nicotinamide adenine dinucleotide or the coenzyme 1. Okay, both X and the V factor can be derived from lysed RBCs, pero si V factor may other sources. Pwede rin naman si bacteria, gaya ng Staphylococcus aureus. It could provide V factor. So pwede natin silang pagsabayin i-grow para tawag nito, makinabang rin naman si Neisseria dun sa V factor na ilalabas ng S. aureus. Okay? Now, yeast and yeast extracts as well as potato extracts are also really good sources of your V factor. Si Neisseria meningitidis, okay na okay sa kanya ang ship's blood agar. Okay? Si gonorrhea, dili mo tubo na og ship's blood agar. Okay? Ang type niya yung chocolate agar plate. Okay? While Neisseria meningitidis, SBA ang kanya. Okay? Also Moraxella. Remember, no, both gonococcus and meningococcus are very sensitive to heat. So mga matay ni sila og ato sila ibutang sa ref. So if you think you are going to be delayed, no, meron naman tayong mga temporary culture media, yung mga transport media natin, they could sustain, no, the growth of these organisms. Pero as soon as you're ready, kailangan natin sila talagang culture na agad. Okay? Do not refrigerate. Okay? So let it stand at room temperature, pero wag naman sanang abutin ng 1 oras, no? Kasi mag-decompose, mamatay din itong mga bacteria natin. Okay? So, how are these really small organisms able to cause human infections? Because of their virulence factors. So, marami silang virulence factors. So, number 1, they have receptors for human transferrin, receptors for transferrin. Remember transferrin, ang ginagamit natin na pang-gather ng iron from the food that we eat, right? Or from the supplements that we take. Okay? So yun yung ginagamit ng human body to gather iron. Pero itong ating Neisseria, meron silang receptors for transferrin kasi nga remember, they need iron too. So nakikisabay sila sa transferrin natin. So si transferrin natin ay nagkokolekta ng iron, hindi lang para sa katawan natin, para na rin sa ating mga bacteria gaya ng Neisseria. Okay? Now, meningococcus has the polysaccharide capsule. Encapsulated kasi siya. Si gonorrhea, hindi naman. But gonorrhea does have pili. Okay? And pili, as you know from previous discussion, are used for attachment, for conjugation. And syempre, pag conjugation yan, hindi naman sexual conjugation yun, di ba? The conjugation is to transfer genetic material. So yung plasmids, itina-transfer nila. And those plasmids may code for properties, no? Powerful properties like resistance against beta-lactam drugs, for example. Okay? And aside from those, they have cell membrane proteins. Okay? They have 3 membrane proteins. So protein 1 or pore. The pore protein are channels for passage of nutrients and waste. So basically, pore talaga, yung P-O-R-E. Okay? Kasi doon lumalabas at pumapasok yung mga nutrients. Now, the pore protein or protein 1 is coded by pore A and pore B. Now, pore B is expressed only by our gonococcus. And the pore B is really important because it is protective by nature. Okay? It protects the organism from inflammatory response, di ba? Like complement-mediated killing. Remember, in inflammation, I think you have discussed this already in your immunosero. Magkakabit yun, di ba? Yung inflammatory response at saka yung complement. So si complement will later on end in a very successful inflammatory response and pwede rin namang patayin ng complement process or complement cascade ang organism, di ba? Cell lysis ang end result ng ating complement fixation. And then yung sidelines, pwedeng mag-trigger ng inflammatory response because of the anaphylatoxins released during complement activation. Okay? And then we have protein 2 or the OPA protein. Okay? So this has been discussed previously. So ang OPA protein is also an adhesin, right? So for adherence. And then we have the RMP or the protein 3. Okay? So this is necessary for blocking host IgG. Okay? Now to add, naapagid sila yung IgA protease. Di ba IgA, alam na natin ngayon na nandun yan sa ating mga mucous membranes, nasa mga opening natin. So importante ang role ni IgA because it is protective by nature. Para yung mga pumapasok ng mga organisms at nakaka-touch down sa ating mucous membrane ay pwedeng patayin ng mga IgA. Pero kung yung organism naman ay may IgA protease, ay wala na. Okay? Pildi na po ato ang immune response, no, or ang atong immune system. Okay, so apart from that, no, meron ding LOS. So this is the most important virulence factor of Neisseria, their lipo-oligosaccharide, which is actually a part of their cell wall. No? So it contains the endotoxin portion of the organism, which is released upon the death of the organism. Okay, so looking at this illustration, you'll see that the LOS is actually embedded in the outer membrane. Okay, and it has three structures. No, may O antigen or the somatic antigen, which is very important in serologic identification of the organism, and then meron ding core oligosaccharide, hindi ko masyado mabasa guys. Core oligosaccharide and the lipid A. The lipid A is the embedded portion, no? Yung pinaka na-embed na portion ng lipo-oligosaccharide, and that actually contains the endotoxin. Okay? So si lipid A talaga ang endotoxin. Now note that during the course of growth, no, and multiplication ng Neisseria, they already start to release outer membrane proteins or yung mga blebs that contains the LOS. Okay? Kaya natitrigger agad ang immune system natin kasi habang nag-grow pa lang sila, naa sila sa ilahang late log phase and early logarithmic phase. Grabe kapaspas sa release sa blebs that contains LOS, and so matrigger good ang immune response. Okay? Kaya automatic na ang bilis lang ng kanyang incubation period. Okay? Lumalabas, nakikita agad natin ang signs and symptoms. Okay. Ano ba ang effects ng endotoxin na sinasabi natin? So the endotoxin, pag namatay ang organism, di ba saka siya nare-release? So this is actually the reason for inflammatory response, and fever. Okay? Fever is brought about by the effect of the hypothalamus. Kasi si hypothalamus yung ating ang responsible sa pang-control ng temperature, no, body temperature. So natitrigger siya because of the presence of the endotoxin. Okay? And then there's prolonged vasodilation and syempre capillary leakage. Pag namatay ang gram-negative organism, mabungkag iyang cell wall. Pag bungkag sa cell wall, ma-release ang endotoxin. Pag-release sa endotoxin, especially pag namatay siya dun sa ating blood vessels, okay, dumidikit yung mga endotoxin sa walls ng ating blood vessels, and that would lead to tears, no? Mapupunit yung mga walls ng blood vessels and lead to capillary leakage. So magkakaroon tinatawag nating bleeding into the skin o yung purpura, gaya niya, no? Ang lalaki ng mga pantal-pantal. So dahil sa biak-biak sa ating blood vessels. Okay? And meron din naman yung maliliit na mga butas, and that would cause petechial rashes. And because of capillary leakage, merong hypotension. Di ba? Ang blood vessels natin dapat intact yan para ang pressure ng blood dire-diretso, mahatid agad ang blood which would carry nutrients and the most important, oxygen for survival and growth ng tissues natin. So dahil butas-butas yung ating blood vessels, hinay kaya ang blood pressure. Mura lang good nag-hose guys, di ba? Sa garden, kung inyong hose buslot, hinay ra kaya ang mugawas dito sa spout, kaya nga buslot naman sa side. Okay? Pero kung walang butas yan, ang bilis nung labas dun sa bunganga ng hose. So in the same manner, ganun din ang blood vessels natin. So kung may butas-butas, ang bagal ng pressure. So dili kay sila paspas mag-deliver of oxygen and nutrients. Okay? That would lead to tachycardia, no, abnormality in the beat pumping ng blood, no, ng heart rather. So irregular and fast. Okay? And then hypotension can also lead to septic shock. Remember, kailangan ng ating mga cells every second, every minute ng oxygen and nutrients, and at the same time, yung waste products nila makuha din. So, yun yung nangyayari during respiration, di ba? So paghinga natin, papasa natin yung oxygen sa blood, si blood naman i-deliver niya dun sa sa mga cells and tissues, okay? Pero kung butas-butas naman yung blood vessels natin, ang hinay ng delivery, di ba nakakainis? So, dili makakuha dayon og pagkaon ng atong mga cells, ma-shock sila. Okay? Hindi sila maka-perform properly. Okay? Kulang yung oxygen, kulang yung nutrients. So, and then nag-build up ang waste products, and so mag-septic shock. Eventually, that would lead to multiple organ failure. And so, mauna yung makamatay sa pasyente nato. Okay, so capillary leakage and hypotension also would lead to intravascular coagulation. So may disseminated intravascular coagulopathies talaga na napapansin in Neisseria infections. Okay, so dito naman tayo kay Neisseria gonorrhoeae. Okay, so disease associated with Neisseria gonorrhoeae is of course the gonorrhea. Okay, and gonorrhea is an acute pyogenic infection. So pus, no, menana. Okay, it's usually seen in non-ciliated columnar cells and transitional epithelium ng ating genitourinary tract. However, pwede rin namang makita sa ibang parte ng katawan. Okay. Gonorrhea is also known as flow of seed. No, the word gonorrhea is taken from a Latin term which refers to flow of seed. Kasi nga naman mukhang semen yung ating na lumalabas, especially sa penile organ. Okay, ayan no, sa picture na yan. Di ba mukha lang siyang semen? Okay, so mukhang tumutulo lang yung semen, pero hindi naman. Okay, sometimes it's confused with syphilis. Okay, note that both syphilis and gonorrhea can occur simultaneously in an individual. O, kaya mag-ingat. Okay? Now, gonorrhea in olden times is also known as clap. Okay? From the French word clapier, which means brothel. Wala ko how no? Clapier. Okay? Brothel. Kasi nga naman, di ba? O, nakukuha naman itong sakit na to ng mga malikot at kung sino-sino yung mga pinapartner. O. And then, in some theories, the word clap may also refer to the throbbing pain na nafe-feel ng mga pasyente, especially yung mga lalaki. Okay? Lalo na pag umiihi sila, oh, masakit daw. Okay? So, in some theories, yun daw yung pinanggalingan ng clap. In other theories also, okay, it may refer to the early treatment of gonorrhea. So dati nagtitreat sila ng gonorrhea by kailangan ipalabas yung nana. So they smash or clap the tin with both hands. I cannot imagine how that would happen, no? Kung ibang tao yung magpe-perform ng process ng pag-clap. So ang projectile ani as sa padalong ani ang malagpot na ano. So kayo na lang mag-imagine kung saan papunta or paano nila ginagawa. Basta it was mentioned na in some references, ganun yung pag-treat sa gonorrhea. Di ba kakaiba? O, buti na lang tayo ngayon hindi na nagka-clap. Meron tayong antibiotics. Okay? So, how do we get this infection? The mode of transmission is almost always sexual contact. Okay? Direct contact, sexual contact. And the infection is usually seen in the urethra and the cervix, anal canal, pharynx, and even the conjunctiva. Okay? The primary reservoir for gonorrhea or Neisseria gonorrhoeae are asymptomatic carriers. Okay? Ang dami kasing may sakit pero walang symptoms. Okay? The incubation period is relatively short, 2 to 7 days lang. Okay? In men, napakadaling ma-identify ng infection kasi tumutulo talaga. Hindi naman nakasaludo pero may tumutulo. So ibang kaso yun. Kung at rest naman, ninghoy, pero naining tulo, awlain na siya. Okay? And also, dysuria, mahirap umihi, masakit umihi, or wala kang maiihi kahit na gusto mong umihi. Okay? Now, 3 to 5% of cases ng Neisseria are said to be asymptomatic for males. Okay? So this is usually due to the AHU strain or the AHU strain. Ano yun? Okay? The AHU strains of Neisseria gonorrhoeae are those that would require, ito yung fastidious na nga sila, di ba? Ito yung mas fastidious pa talaga. Kasi kailangan nila ng additional amino acids for growth. These are arginine, hypoxanthine, and uracil. Kaya naman AHU ang nakalagay dyan, guys. Okay? So, very common talaga ito in women, pero pwede rin naman in men. Okay? So, ang AHU strains are common causes of asymptomatic gonorrhea. Now, for women, okay, for women, ang common site is syempre yung endocervix. Kaya patago. Okay? So, nanonotice na lang na merong cervical discharge na yellow, may amoy, sometimes may dysuria, masakit umihi, no? Or makate. Okay? And usually yung lower abdominal pain is common. Now, 50% of women are asymptomatic. O di ba ang dami nun? Kaya naman sila yung malakas na nagsha-shed off ng organism. Kasi hindi nagpapatreat. Kasi walang nafe-feel. Walang discharge, Well, hindi nahihirapan umihi, walang abdominal pain, nakakatakot. Okay? Now, dahil marami ang asymptomatic, di jud magpatambal, may ipatambal, may gibati, no? So, dahil ganun ang case, maraming complications sa babae. Okay? So, ang pinaka-common are pelvic inflammatory diseases or PIDs kung tawagin. So, this usually affect the organ in the pelvic area, like your fallopian tube. So, kung fallopian tube ang inflamed, we have salpingitis or oophorytis. Ito naman ay inflammation of the ovaries. Pwede rin namang ma-inflame ang uterus, no? In some cases, this could also, no, the pelvic inflammatory diseases may also lead to sterility, pagkabaog. No, nga naman na. Okay? If the fallopian tube has been inflamed or has been victim to pelvic inflammatory diseases caused by the gonococcus, pwedeng magkaroon ng scarring. Remember, ang ating fallopian tubes, napakaliit ng daluyan yan, di ba? Ang lumen niya napakapayat. Mas payat pa sa appendix. Parang yung gel, yung lalagyan lang ng ink sa loob ng ballpen ninyo. Ganun lang kaliit. Ang fallopian tube. So kung nagka-inflammatory disease yan, magkaka-scar. So minsan ang scar may cover the entire lumen, iba-block na yung lumen. So hindi makadaan ang sperm cells. 'Di ba dapat ang mating nila is somewhere in the fallopian tube. So si egg cell, maghihintay yan sa fallopian tube no kanyang partner. So dahil may scar tissue, dili makalusot ang sperm cell. So baog, no? Worst case, kung ectopic pregnancy, paano naman nangyayari yun? So same thing, pag nagka-scar ang fallopian tube, pero yung scar niya hindi totally nagko-cover dun sa lumen, pwedeng makalusot si sperm cell, makatabok siya dito sa pikas. Okay, pikas na side. So ma-fertilize niya si egg cell, mahimong zygote. Apan, mudako man ang zygote. Dili na siya kalusot, kaya di ba dapat mag-roll siya, no? Yung zygote o yung fertilized egg, dapat mag-roll papunta ng uterus at ma-embed dun sa uterine lining. Pero dahil may scar tissue, hindi makalusot, mas malaki siya kaysa sa sperm cell, so di na siya kalusot, mabara siya dito. So dito mudako ang zygote. Pero ang problema kay dili man gud maka-expand maayo si fallopian tube kay gamay raman siya. So it can only expand so much. Eventually, mubutog yun siya. So the pregnant woman would feel pain talaga. So kailangan natanggalin yun. Okay? And then there are some individuals who demonstrate or show involvement ng gastrointestinal tract, no? O meron silang perihepatitis. Dito, the inflammation was able to cross, no, yung blood barrier and has come into contact with the linings ng liver. O dito sa perihepatitis, it does not include the liver itself, but yung lining lang naman, okay, pag perihepatitis pa. Eventually, pag napabayaan yun, baka pwede rin namang ma-inflame ang liver. Okay? Pero pag ang perihepatitis, yung lining lang yan, no, ng liver natin. So it's also known as the Fitzhugh-Curtis syndrome or the FHC. Ayan, so ang tendency nito, ma-inflame, no, yung lining ng liver and nagkakaroon ng adhesions. Ayan, ito yung nakikita nyo parang naka-stretch out, parang webs, no? Nag-adhere na yan na lining ng ating liver dun sa ibang organ. Okay, brought about by the gonococcal infection. Okay, so other infections are gaya nito, disseminated gonococcal infection. So pag nakalabas sa ating genitourinary tract, it could also cause infection in other area. No, pag nakapasok sa bloodstream, it could cause septicemia and cause different types of infections. Usually, DGI is caused by the Agu strain. Okay? So merong septic arthritis, okay? O involve yung synovial, no, yung joints mo, polyarthralgias, ganun din, no, joints din. Or pwede din namang magkaroon ng tenosynovitis, which is the inflammation of the membrane that covers your tendon. Okay? And then pustular skin lesions, these are quite common, endocarditis and also meningitis. Okay? And then meron din tayo ng ophthalmia neonatorum. So the gonococcus can also cause this infection in newborns, especially kung ang nanay ay may gonorrhea. So bakit nagkaganito? Okay? Remember, ang pinaka-common na manner of giving birth is normal delivery, which means dadaan sa vaginal canal. Okay? And ang pinaka-common na type ng normal delivery is yung cephalic, nauuna yung ulo, di ba? Hindi breech. Hindi naman rare ang breech, pero mas common talaga yung cephalic, nauuna yung ulo, di ba? And dahil nauna yung ulo, ang pinakaunang mucous membrane that would come in contact with the infected birth canal would be the eyes. Okay? Ang problema lang ani kay kung mga nakasabalay. Okay? So walay makatanaw na professional unless certified na midwife yung nagpaanak sa'yo. Alam na nila yan. Pero kung hilot-hilot lang, ang hirap nun. Okay? Pero yung mga ipinanganak na sa hospital, alam na yan no, ng mga nurses, ng mga doctors. So kung may ganitong klaseng incident, usually madali lang yan, no, mga about 24 hours after birth, makita na nila, mag-swell ang mata sa baby. So butangan na nila o treatment. Usually naman lahat nilalagyan na yata nila. Kasi pag tinignan mo yung baby, parang mga naka-eyeshadow. Okay? So, previously, the treatment used is Creed's prophylaxis. Okay? That's 1% silver nitrate. Pero dahil ang pag silver nitrate ang nilalagay natin, nagkakaroon siya ng parang shadow, parang nag-eyeshadow si baby. Parang na-black eye yan. Okay? So ngayon, erythromycin drops naman lang na ang ginagamit natin. Gaya niyan. Okay? So, laboratory diagnosis, mag-unsa man ta. Okay? So, ang specimen natin are, syempre, ang pinaka-common yung mga purulent discharges from your genital sources, no? Urethra from men and the cervix from women. Pero pwede rin namang galing sa rectum, pwede rin namang galing sa pharynx. Di ba? Kasi nga, iba-iba yung sexual style. O, di ba? May video okay, meron din namang helicopter, kung ano pang style. So, kayo na bahala. Okay? And pwede rin joint fluid, guys. Okay? Remember, pwedeng mag-cause ng polyarthritis, pwede rin namang mag-cause ng infection ng synovial fluid, okay? Septic arthritis rather. Okay? So, pwede rin naman ng blood kasi nga 'di ba may disseminated types ng infection. So pwedeng blood. Pero remember, if you're going to collect blood, do not use SPS. Di ba? Kasi blood culture din to. Pero remember, sa discussion natin dati, previously, si Neisseria, ang isa sa mga sensitive sa SPS, no, sa effects ng SPS. Mamatay sila doon. So instead, use gelatin on your blood culture tubes. Okay? Now, sa mga lalaki, if there are no apparent discharge, pag asymptomatic, pwede tayong mag-swab. Okay, so swab is inserted up to about 2 centimeters into the anterior urethra. And then slowly rotated, gaya niya, no? I-rotate mo para naman yung buong area ng swab mo ay makakolek. Okay? So, pero pag swab, remember, kailangan ng dalawang swab dahil yung isa for direct microscopy at yung isa is for inoculate. Okay? Kung rectal swab naman ang gagamitin natin, the swab has to be, or i-collect natin, the swab has to be inserted 4 to 5 centimeters into the anal canal. Okay, and then ganun din, i-rotate mo din yung swab. Now, anong klaseng swab ang gagamitin? Okay, previously, sabi natin, calcium alginate is pwede, di ba? For nasopharyngeal samples. Pero if you're going to isolate Neisseria gonorrhoeae, huwag gumamit ng alginate or cotton swab. Okay? Kasi they would inhibit your Neisseria gonorrhoeae. So, ang best is your Dacron swabs. Okay? Dacron swab. And then immediately, as soon as you're ready, kailangan natin na ma-inoculate yun sa primary isolation media. Or if not, at least, no, ito, yung transport media, meron na yung culture media sa loob, itong may swab. Okay? Or, etong ating Gembec. Ang maganda ito, kasi yung Gembec, pwede siyang transport, pero pwede na rin siyang gamitin sa laboratory actually. Okay? So, mamaya tignan natin kung paano. Ayan. So, yung commercial transport systems natin, ito na nga si Gembec. Ayan. Okay, so you're going to use your swab. Kompleto na yan. It's already a selective media and meron na rin siyang carbon dioxide atmosphere. Okay? Tapos, note lang na pag inoculate tayo on our Gembec, kailangan yung zigzag pattern or the Z pattern. Okay? Ito Z, klaro kayang Z, no? And then pagdating sa lab, pwede mo lang yan siya i-streak with the loop. Kaya nakikita mo yung streakings. Okay? Diba? Klaro ang Z, pero klaro gyapon ang streakings, pwede na siya i-incubate na ni mo dayon. Or the trans grow, ayan. So chocolate agar plate, ito silang lahat guys. Okay? Na-enrich lang. And then na-patented lang kasi may mga sarili-sariling mga style. Ayan. And then yung gonopack natin. Okay? So, pagdating ng sample sa laboratory, anong gagawin? Ang first method of identification is naturalmente, direct microscopic examination. Pag sinabing direct microscopic examination, ang gagamitin natin ay ang specimen mismo. Gagawin nating smear. And then, iga-gram stain natin. So, anong dapat makita? Gram stain should be gram-negative intracellular diplococci. However, meron din naman tayong mga extracellular. Sinasabing ito daw yung mga virulent forms kasi nawala na sila ng abilidad to attach to host membranes. Okay? Note lang, if you're going to process nasopharyngeal samples, hindi sila magandang i-gram stain. Pero actually sa lab, gina-gram stain na nila yan. Pero ideally, di siya maayo because pag nasopharyngeal, ang daming microbiota, normal microbiota. I-note lang. Okay? So kung walang ibang staining method, edi perform gram stain, but note na yung sample mo galing sa nasopharyngeal area. Okay? So, after your direct microscopic examination, do culture. Okay? So, pag nag-culture, remember, si gonorrhea ayaw ng SBA, ayaw ng BAP. Okay? Mas i-prefer niya si CAP. Okay? And then, incubation temperature is 35 degrees Celsius. And remember, yung increased carbon dioxide supply. Also, remember, increased humidity is needed. So, pwede naman yung pag may ganito ka, closed jar, okay, that would create moisture. That would be good. Or, kung meron kang carbon dioxide incubator, sister naman, okay? So, may humidifier na yan, no, built in. Or kung wala talaga, yung kagaya lang nasa 302, okay? Pag yung incubator natin, gaya lang nung sa 301 pala. Okay? So, maglagay lang ng pan of water at the bottom of the incubator. So, yung pinakadulo. Okay? Doon ka maglagay ng isang lalagyan na may water para may humidity si gonococcus. Okay? So, ano ba yung mga culture media na pwede natin gamitin for your gonococcus? Ang dami. So, remember, chocolate agar plate, okay na. Pero ang ating mga gonococcus ay sadyang maaarte. Kailangan ng enrichment, additional supplement rather. Okay? So, culture media would include Thayer Martin. Okay? So, ang Thayer Martin has inhibitors, no? So, selective yung ating Thayer Martin. It contains vancomycin, which would inhibit gram-positive organisms, colistin, which would inhibit gram-negative organism, and your nystatin, which would inhibit fungal organisms. Okay? So, syempre, ang mga nutrients doon, nandun si X factor, nandun si B factor, may vitamins, may coenzymes, dextrose, no? Si modified Thayer Martin naman, halos pareho ng laman, nag-differ lang sila sa inhibitory substances. So, meron din siyang vancomycin, may colistin, may nystatin, at may additional na sangkap. Okay? Ang trimethoprim lactate. This is used to inhibit the swarming. Okay? Swarming growth of proteus. Minsan kasi, nagko-contaminate si proteus sa culture natin. At ganito yung kanyang colony. Ayan, tignan nyo. So, ito yung example ng swarming colony. Di ba ang cute? Para lang cabbage rose ang itsura. Okay? So, concentric rings. Okay? So, ganyan yung pag-swarm. At pagpupuno niyo yung entire surface area. Okay? So, what tayo makitang Neisseria na matubo kay puro na lang proteus. So, to inhibit that, trimethoprim lactate is added. Okay, note that etong dalawa, best na best for gonococcus. Pero pwede rin naman gamitin kay meningitis. Okay, kasi nga si meningitis ay, although fastidious siya, pwedeng gumamit ng cap. Okay. Then may have Martin Lewis. Okay, so ang Martin Lewis agar, similar din sa unang dalawa. Okay, meron siyang vancomycin, may colistin, may trimethoprim lactate, meron din siyang antifungal. Pero instead ng nystatin, ang antifungal ng Martin Lewis ay anisomycin. So the anisomycin is Okay, sorry po, wrong spelling pala, mycin. Dapat M-Y-C-I-N. Okay, pakicheck na lang dyan sa inyong mga notes. Okay? And then, may additional components. So, syempre, may X factor, may V factor, may vitamins, may amino acids. Pero ito, may dagdag na cornstarch. Ayan. Si cornstarch ay pang-neutralize ng fatty acids. Just in case pala, nakalimutan yung gumamit ng dacron at ang nagamit nyo ay sina alginate at si cotton swab. So may pananggalang si Martin Lewis. Okay? Then the New York City agar, again, pareho lang, no? May vancomycin, may colicin, may trimethoprim lactate. Again, dito lang sila nag-differ sa fungal, antifungal. So ngayon, si New York City agar, ang kanyang antifungal ay amphotericin B. So mas matapang. Okay? So, eto, no? Meron siyang kagaya lang nung nasa taas, pero may additional sodium chloride to observe the correct osmotic equilibrium. Okay, so may balance para sa electrolytes, may sodium chloride. Again, best ito for gonococcus, pero pwedeng gamitin din for meningitis. Okay? Now, after incubation, syempre kukunin mo yung iyong culture, titingnan mo yung kanyang colonies. Expect that the colonies, kung Neisseria siya, are small, gray to tan, translucent. Ayan, no? Parang medyo transparent na hindi naman. Okay? And raised siya. So convex. Okay? Ito is true for colonies that are observed within 24 to 48 hours of incubation. Now remember, no, note there are 5 colony types. Merong T1 and T2, which are for virulent types. Okay, so ang T1 and T2 are pileated, okay, and virulent. They appear to be smaller and raised and medyo bright pag natamaan ng reflected light. The T3 and T5 are non-virulent colonies, no? So they are non-pileated, usually larger and flat ang colonies. And of course, meron tayo nung aho colonies. So ito are smaller and they would grow slowly. Inuubos nila yung isang linggo ng cultivation or incubation rather. And do remember when you culture, always work with fresh culture. Yung mga nasa 24 to 48 hours na incubation. Kasi naman, nainom ng tubig, di ba? Kasi etong ating organism has a tendency to autolyze themselves. Okay? Nag-auto-destruct sila pag medyo matagal na. Manluod dayon kung dugay ni mo sila tag dun. Okay? So, fresh culture. Use fresh culture for your workups para mas desirable yung mga results. Okay? So, after culture, pwede tayo mag-ulit ng ating gram staining. Okay? So, now we call this indirect microscopy because our inoculum this time will come from your colonies. Okay? Kanina sa direct, galing mismo sa sample. Pero pag indirect, galing na siya sa colonies. So, observe pa rin, no? Yung ating gram-negative diplococci and hanapin yung bean or kidney shapes. Sometimes, okay, nakukulture natin kasama si Kinyela at si Acinetobacter. So may mga rods. Okay? Okay, so for presumptive biochemical test naman, di ba, may biochemical pa rin tayo dito sa Neisseria. So we were able to cover this the last time under biochemical tests. So cytochrome oxidase, no? So we use this for identifying your Neisseria presumptively. Okay, so alam na natin kung yung mga principle niyan at yung reagents na ginagamit natin. So just to remind you ano yung mga positive results na in-expect natin. Siyempre, pag-add nung ating colony, right? Diba, ipapahid lang natin yung colony natin dito sa filter paper, no? Nabasa nung ating reagent. Pag nag-purple, that's positive for oxidase. Okay, 10 to 30 seconds. Pag walang change, so negative siya automatically. Okay? Or, pwede rin naman na diretso na kung tinatamad na kayong gumawa ng ganitong setup, filter paper, pwede namang diretso na lang sa colony. Kung hindi niyo ba gagamitin yung colonies niyo for other purposes, why not? No? So dito na lang ibutang ang TMPDD. So pag naging deep purple to black ang colonies, gaya ng nakikita natin sa plate ngayon, so pwede nang i-report yan as positive. Okay? Now, the definitive test for identification of Neisseria ay walang iba kundi ang carbohydrate utilization test. So, gaya din ng ating enteric, ito rin ang pinaka-definitive test na ginagamit natin. Although, of course, pag nag-molecular level tayo ng testing, definitive test din yun. Okay? So, kung wala, carbohydrate utilization test using the cysteine trypticase agar is the definitive test for Neisseria. So, this, of course, from the looks of it, would contain phenol red as the indicator, no? Kasi nga naman, pag pula at naging yellow after incubation, edi phenol red talaga yun na reaction. Okay, the sugars usually incorporated in this type of culture media are glucose, maltose, sucrose, and lactose. Now, Neisseria gonorrhoeae is only able to utilize glucose. Madali lang i-memorize dahil gonorrhea, G, at glucose, na G rin naman. Okay? So, si NG, G lang yun yung sugar na ma-utilize. Okay? And then, other forms of carbohydrate utilization test is yung ganito, chromogenic substrates. Similar lang din ang principle, nag-change lang ng color if nakapag-ferment ng sugar ang ating organism. So, same thing, glucose lang pa rin ang kanyang ma-ferment. Hindi naman nagbabago yung ating organism. Magbago man yung mga test na gawin natin, yung sugar na kanyang ma-utilize, yun at yun pa rin. Okay? Now, the good thing about this type of method, yung chromogenic method, is that it is able to identify gonococcus with aberrant carbohydrate utilization reactions. Ibig sabihin ng aberrant, guys, idagdag natin sa ating vocabulary dahil bago ko lang din siya nalaman. Aberrant is unusual, uncommon. Okay? So may mga Neisseria gonorrhoeae kasi na variable ang kanyang reaction. May mga strains na minsan nagre-react, minsan hindi. Okay? So pwede nating hulihin using this method. Okay? Then we have the multi-test method. So you can use this not only for checking out carbohydrate utilization method, carbohydrate utilization properties of your organism, but you can also do DNA testing and beta-lactamase identification in this strip. Diba? So nice siya. And pwede rin naman gamitin for Haemophilus and Moraxella. So kaya naman multi-test. Okay? Now, what about gonorrhea that are resistant to beta-lactam drugs? Okay? Hindi lang naman yun kay Staphylococcus aureus, no? Meron din si Neisseria. So again, to review, your beta-lactam drugs are penicillin and penicillin-based antibiotics, no? So kagaya ng cephalosporins, carbapenems, monobactams, all of them possess the beta-lactam ring. Okay? Now, the action of this ring or the drug itself is that the ring, once it enters the body, binds to the penicillin binding proteins or PBP, or also known as the transpeptidases. Naalala pa ba? Okay, so yung PBPs are the transpeptidases na nakikita sa peptidoglycan layer ng mga bakterya. Di ba? Ano nga ang trabaho ng transpeptidases? Remember, they are those that are responsible for creating the links para yung NAM and NAG, no? Ito nakikita natin light green and dark green dito, okay, na mukhang basilay. Yun yung NAM and NAG, di ba? N-acetylmuramic acid and N-acetic glutamate, yun yung ating components ng ating peptidoglycan. Okay? So, para naman maplastar sila, madikit sila tarong, kailangan may peptide bonds. And so, ang peptide bonds ay pinagdidikit-dikit ng ating PBP or ng transpeptidases. So, kung na ay beta-lactam ring, kaning si beta-lactam ring, mupilit siya dito sa PBP or transpeptidases. And so, it cannot attach dun sa mga peptide bonds. Maunang madaot, mabungkag ang cell wall sa organism. Okay. Pero naging bright na sila after some time, no? Yung mga organisms, nag-create na rin sila ng kanilang beta-lactamase or penicillinase, no, na enzyme that can destroy the beta-lactam ring. It would hydrolyze the beta-lactam ring. Okay? So dito, in this image na nasa gitna at nandito sa far right, you see, yung action ng beta-lactamase. Okay? So yung purple things that you see there ng pambahay are the beta-lactam rings. So ideally, no, kung ang beta-lactam, dumidikit siya dun sa PBP, etong horseshoe na shape sa baba, para mamatay ang organism. Pero dahil naging bright ang organism, meron silang enzyme that could attach doon sa beta-lactam ring and hydrolyze it. And so magiging useless ang drug. Iinom ka ng inom, bili ka ng bili, hindi naman sila natatablan. Okay? Now, aside from staph and Neisseria, E. coli also has the ability to produce beta-lactamase enzyme. Okay? So again, how do they get this? Siyempre, nakukuha ito ng mga organism by virtue of conjugation. Okay? Hindi naman sila ipinanganak na may mga ganyan. They acquire the property. Okay? So, a very useful test to determine the presence of beta-lactamase sa ating Neisseria gonorrhoeae is the saphenase test. You can find this in Delos. Okay, so the saphenase test makes use of an antibiotic disc, okay, a saphenase disc, which is impregnated with cephalosporin. Okay, so ang cephalosporin has a beta-lactam ring. Okay, so madali lang, parang kagaya lang ng oxidase test natin. So babasain mo lang yung ito incorporated naman siya. So para lang moisten siya, lalagyan natin ng distilled water, no? Sterile distilled water para medyo moist yung ating disc. Okay? And then, mukuha ka, no? Using your needle or an applicator stick, get a portion of your colonies, okay? And then, i-wipe lang dun sa surface. Now, originally, yellow lang yun ang color sa imuhang disc. Now, if it changes to red, that indicates a positive reaction for the presence of beta-lactamase. So, yellow to red, no? Naging red, positive yan for beta-lactamase. Okay. So, kung si Staphylococcus, ang tawag natin dun sa resistant strain ay MRSA. Ang tawag naman natin sa resistant strain ng Neisseria gonorrhoeae are PPNG, no? So penicillinase producing Neisseria gonorrhoeae. Ito sila yung may beta-lactamase. Okay, so resistant to penicillin. Okay, so ang current recommended treatment for Neisseria infections, gonococcal infections is cephalosporin. Okay, CDC recommended for uncomplicated gonorrhea, meaning hindi ito DGI. Okay, yun lang usual na genital gonorrhea. So pwedeng ceftriaxone, cefixime, ciprofloxacin, ofloxacin, or levofloxacin. Okay. So, dito naman tayo sa Neisseria meningitidis, guys. Okay? So, ang general characteristics ng ating Neisseria meningitidis are the following. So, note, si Neisseria meningitidis is a causative agent of meningitis and meningococcemia. Okay? This is a type of sepsis, no? Septic meningitis. Okay? So, pero, okay, ang unusual dito is that si meningitis is actually a commensal of the upper respiratory tract. Okay? Commensal ng ating upper respiratory tract. Nakulangan ng respiratory. Okay? So, may mga asymptomatic carriers tayo. About 5 to 10% of the population have Neisseria meningitidis as normal flora in their pharynx and oropharynx. Okay? So usually mga adolescents, young adults, especially yung mga nasa large groups na parating magkakasama, yung mga nasa dormitory o in particular yung mga military recruits. Kasi nga 'di ba, may pinapagawa sa kanila na magkakasama sila parati, no? Ayan. And then what else? Note that for Neisseria meningitidis, humans lang naman ang only natural host. Kaya treatable ito, guys. Hindi kagaya ng flu na kailangan taon-taon kailangan nating magpabakuna dahil wala tayong magandang immunity dahil pwedeng papalit-palit from animal to human host. Okay? So, transmission, mode of transmission is syempre close contact with a susceptible host. Okay? So risk factors, sino ba yung mga madaling mahawaan ng ganitong infection? So number 1, mga asplenic individuals, yung mga natanggalan na ng spleen. Okay? So remember, ang laki ng role ng spleen natin kasi yung mga spleen natin may mga macrophages yan, no? Splenic macrophages na nagtutulong para makafilter ng infectious agents sa blood natin. So kung nakulangan sila ng organ na nagpo-produce ng mga pwedeng mag-screen out ng mga organisms na to, malaking factor yon na pwede silang magkaroon ng infection. Or persons with complement deficiencies, no? Yung mga deficient sa MAC, di ba yung membrane attack complex natin, si C5, C6, C7, C8, and even possibly C9, no? So, dili mamatay. No, mupilit lang ang complement, ang C1, C2, C3, C4. Mupilit lang din niya. Magunsa sila, wala. Mag-fashion show sila sa surface sa ato ang unsa ni antigen antibody complex. Dili mamatay ang organism, no? By lysis. Di ba cell lysis ang end product or end result ng complement activation. So dahil kulang ka sa MAC, ayan, hindi mo mapatay yung organism, no? Kaluoy. Or those that are active and passively smoking. O, kung meron kayong kasamang naninigarilyo sa bahay, badlungon jud, kay kamo nga dili manigarilyo pero kauban mo, you are passive smokers, di ba? O, so, mas prone kayo to acquiring this, di ba? Kasi, nakita niyo naman yung mga virulence factors. May IgA nasa mga mucous membranes natin. Eh pag nagsusmoke kayo, yung mucous membrane natin humihina, 'di ba? Nagiging abnormal pa minsan yung kanyang epithelium dahil sa excessive smoking. Kaya iwasan. Okay? And syempre pa crowded living condition. Okay? So, ano ba yung mga virulence factor? Aside sa na-mention natin earlier, inote lang natin ulit na ang pinaka-importanting virulence factor ni Neisseria meningitidis ay ang kanyang polysaccharide capsule that allows it to cross the blood-brain barrier. Ayun. Okay? And then, syempre, pilated siya, di ba? Oh, so, yan. Kailangan nung, yun yung pinaka-importanteng virulence factor niya. Kaya nakakapag-cause siya ng ganyang klaseng infection. Now, there are several pathogenic strains of Neisseria meningitidis. There are actually 13 serogroups, no? A, B, C, D, H, I, K, L, X, Y, Z. Okay, 29E and W135. Okay, B, C, Y are predominant in the US, while A, B, C, Y, and W135 occur worldwide. Okay, now disease association. Incubation period is 1 to 10 days, again, relatively short, no? It adheres and colonizes in the nasopharyngeal mucosa, and from there, the organism can enter the bloodstream. Okay? Ang disease na usually associated with meningitis is, of course, meningitidis is, of course, meningitis. No? It's the abrupt onset of, characterized by abrupt onset of frontal headache, nerve sickness, stiffness, confusion, o parang litong-lito, and photophobia. Okay? And then eventually, pag nagkaroon ng sepsis pa, no, nagka-meningitis, tapos hindi na-treat properly, it may progress to meningococcemia. Okay? So, fulminant type or severe form of meningococcemia is characterized by the presence of purpura. O, gaya niya, no? Ang lalaki na ng pantal-pantal ng baby, kawawa naman. Okay? So, nag-hemorrhage. Okay? Nagli-leak yung kanyang mga blood vessels into the skin and mucous membrane, producing yung akala mo ay bruises. So, hindi naman talaga yung bruises. Those are actually the effect of your bleeding blood vessels. Okay? And then, may mga petechial rashes din. Yung mga maliliit, those are petechial rashes. Okay? So, ano ba? Aside sa purpura and petechial skin rash, there's sepsis, of course. No? Doon nga nang galing yung meningococcemia na term. Okay, may nandun na yung organism sa bloodstream. There could be tachycardia, so over 100 beats per minute, di ba? Normally, nasa 77 lang yun. 70 beats per minute pataas. Okay? There's hypotension. Ang bilis ng, ng blood. Kasi nga hinahabol niya yung binibilisan ni heart. Kasi, di ba, may hypotension ka para, again, to maintain equilibrium. Naghahabulan sila. Parang, nagsasabi yung body natin na kulang yung oxygen di dumarating. So binibilisan ni heart na mag-pump. Baka naman sakaling maipush yung blood. Pero dahil nga butas-butas yung blood vessel, Hindi pa rin. Okay? And then eventually there's thrombosis. Okay? Disseminated intravascular coagulation. Okay? And then we have the Waterhouse-Friderichsen syndrome or the WFS. So, eto naman, ang affected area is the adrenal glands. No? So, there's hemorrhage in the adrenal glands resulting from bloodstream dissemination of Neisseria meningitidis. So, again, nakikita rin in fulminant meningococcemia. No? So, it occurs in pediatric population, no? Sa mga baby. Okay, so it's an emergency. Usually very poor ang prognosis or madalas namamatay ang pasyente. Okay? So anong ating gagawin? Okay? Ang samples that we are usually going to process are CSF. So hindi tayo magko-collect niyan, si doktor. Okay? Blood, ayan, pwede tayong mag-collect nito. Okay? Nasopharyngeal swabs, aspirates, joint fluids, sputum, and urogenital samples. Okay? Again, remember, hindi pwedeng gamitin ang SPS pag nag-blood culture. So, gumamit ng gelatin. Okay? So, an nasopharyngeal swab is done to determine the carrier status of asymptomatic individuals. Okay? So, with your specimen unsay buhaton, mag-direct microscopy. So, you do gram staining and then expect that you'll be able to see intracellular and extracellular gram-negative diplococci. Okay? So, pag nag-culture, okay, pwede namang mag-culture ng ating initial culture media is blood agar plate, no? Ship's blood para maganda-ganda yung ating tubo. At pwede rin naman ulit gamitin ang enriched chocolate agar plate. So you can go for modified Thayer Martin or Martin Lewis. Okay, and then incubate in the same atmospheric conditions as your gonococcus and examine daily until 72 hours. Okay? So after 24, after 48, and then finally after 72 hours. No, colonies are smooth, round, glistening, and gray, and mucoidal. Ayan, no, nakikita naman na mukhang basa ang colonies. That's typically due to the polysaccharide capsule. Okay? And then, after your culture, pwede ulit mag-indirect microscopy galing sa iyong colonies. Okay, so gram-negative cocci, diplococci with adjacent ends stuck together. Do your presumptive test, yung ating oxidase. No? So, oxidase test and presumptive test. Siyempre, magpa-positive siya for oxidase. So, how do we differentiate it from gonococcus? We do our definitive test, yung ating carbohydrate utilization test using the CTA, no? Or cysteine trypticase agar. Okay? So, for Neisseria meningitidis, okay, nandun yung M and G. So, na-fertilize, na-utilize niya yung maltose maliban sa glucose. Okay? So, it can now utilize 2 sugars. Kanina si gonococcus, glucose lang. Ngayon, meningitidis can utilize both glucose and maltose. Okay? So, yung ating algorithm or schematic diagram. Okay? So, ang ating schematic diagram ay so specimen, okay? Direct microscopy, okay? So do direct microscopy and then gram staining, okay? And then intracellular and syempre pag nag-gram staining tayo, we will be able to find, no, intracellular and extracellular gram-negative diplococci. No? So after nyan, you culture blood agar plate for your meningitidis and enriched cup as your for your gonococcus. Okay? And then, pwede ka rin ulit mag-selective media for meningococcus. So, mag-BOP and cup ka, no, for meningococcus. So, after that, incubate. And then, pwede ka ulit indirect gram staining. Okay? And then, do your presumptive test, no, your oxidase test. And then definitive test natin is carbohydrate utilization. Of course, you can do molecular testing, pwede. Okay, after mo, do your sensitivity testing. Okay, para makapag-set tayo ng magandang treatment regimen for your patients, for the patient rather. Okay, so that's the algorithm or the schematic diagram for Neisseria. Okay. So, non-pathogenic Neisseria naman natin ay, sorry po, wrong spelling ating Neisseria, kaya pa kayo correct. Okay, so may mga non-pathogenic tayo gaya ni Cinerea, ni Flavescens, ni Lactamica. Some of them are normal microbiota. Okay, some are actually non-pathogenic. Okay, some may be isolated from human samples, but may not really cause severe infections. Okay, except for immune-compromised patients. Okay, so si Cinerea would resemble Gonococcus. Okay, so they're quite common in their glucose utilization and the type of colonies that they produce. Okay, to differentiate them, okay, your Neisseria cinerea can grow on SBA and it is susceptible to colistin. Si Flavescens naman would mimic cinerea. So to differentiate it, no, to differentiate them, your Flavescens can grow on SBA or CAP, okay, at 22 degrees Celsius, no, and produce yellow-colored colonies. Okay, and for Lactamica, si Lactamica is similar to Meningitis. Okay, so pareho sila glucose and maltose. Okay, although si Meningitis si Lactamica rather, slow lactose fermenter siya. Okay, so you can perform ONPG. Natural, si Meningitis magne-negative sa ONPG kasi nga, only glucose and maltose ang pwede niyang i-utilize. Si Lactamica, glucose and maltose plus it's a slow lactose fermenter. So magpa-positive siya dito sa ONPG. Okay? And then we have Neisseria mucosa. Okay, so to differentiate that from Zika and subflava, do reduction of nitrate to nitrite, okay, nitrate to nitrogen gas rather. So positive C. mucosa. And then for Polysaccharia, to differentiate it from Meningitis, grow it on nutrient agar. Okay. So dili kay siya, di ba? Dili siya fastidious. Okay, kung si Meningitis pa na, di na mutubo sa nutrient agar. Okay? Okay, so to continue, dito na tayo sa Moraxellaceae. Okay, Moraxellaceae. Okay. So there are 3 known members of this family. We have the Moraxella, Acinetobacter, and the Piscrobacter. Tama ba yun? Okay, Piscrobacter. Okay. So note that Moraxella catarrhalis is only isolated in humans and part siya ng ating upper respiratory tract na microbiota. Okay. So disease association, it's an opportunistic pathogen. So known to cause infections in immune-compromised individuals. Okay, so it could cause upper respiratory tract infections even in healthy people and in children. No? So although opportunistic siya, pwede siyang mag-cause ng infection for known healthy individuals. Pero pag healthy naman, the severity may not be high. No? Usually pag lang talaga, pag merong pag merong underlying conditions, yan, no, nagiging severe. So for persons with tawag nito, with underlying conditions like COPD, no, chronic obstructive pulmonary disease, ayan, no, so it could go lower, the infection could go lower, mas delikado. Okay, so it's an opportunistic pathogen. Okay. and may cause severe infections in people with underlying conditions, no? So apektuhan pati lower respiratory tract, okay? So for healthy individuals, okay, upper respiratory tract infection lang. So simpleng ubo, okay? O pangangati ng lalamunan, mga ganyan, no? So it's for children, ito yung third most common cause of acute otitis media and sinusitis, no? Katong mga bata nga di pa gani kabalo manikma. Okay? So may sipon, usually hindi nila nasisinga properly, nagka-clog, no? Nagkakaroon ng sinusitis. And then syempre dahil meron tayo nung eustachian tube, right? That opens our nasal cavities directly into our ears. And so pwede talagang magkaroon ng ear infection. Okay? Pero for, again, in immune-compromised people, pwedeng maging life-threatening ang diseases na nakukos ng Moraxella. Okay? So, pag nag-gram stain tayo, expect for the presence of intracellular gram-negative diplococci pag respiratory tract ang samples natin. Okay? So, your Moraxella can also be positive for beta-lactamates. Yan, no? So, specimen collection, syempre, kung ear infection, no, may otitis media, edi middle ear effusion, no? Kung may sinusitis, edi nasopharynx sinus aspirates, okay? Pag upper respiratory tract, bronchial aspirates, no? Sputum aspirates, pwede naman for lower respiratory tract, okay? So sa ear ito, yung ating tympanic membrane. Tapos although hindi ko masyado makita at my end, pero nakikita yung parang meniscus, ayan, so nakikita ko na siya. Okay? Yung meniscus ng fluid, no? Yung effusion is fluid na nakikita pag merong inflammation. Okay? So pag nag-culture tayo, Moraxella can grow well on BAP or CAP, and they are known to produce opaque great white colonies. Okay? Young colonies are described as hockey puck. Okay? Parang yung ano nila, katong pamato pag nag ice hockey. Okay? So, di ba? Kasi parang pinapasa-pasa, napapasa-pasa natin yung colonies na hindi siya nasisira, no? Dili mabungkag, mabalhin-balhin siya, dili mabungkag. That's for young colonies. However, older colonies tend to have the characteristic wagon wheel appearance. Ayan. Kasi nag-collapse na yung kanyang mga, di ba kasi convex siya. So pag matanda na, mag-collapse yung kanyang okay, so the wagon wheel appearance again is common pag old na yung ating colony. So bumabagsak yung kanyang pagiging convex. Naiiwan na lang yan. A few places, no? On few places na iiwan yung pagka-convex. Kaya ganito yung kanyang itsura. Again, this is for older colonies. Okay? Now, your Moraxella can actually tolerate low temperature and can grow well at 28 degrees Celsius. Di ba? Unusual. And then, it is inhibited by colicin, no? Na pwedeng present sa culture media. Okay? They're oxidase positive and catalase positive, much similar to the two clinically significant Neisseria. However, they are asaccharolytic. Okay? They're not able to utilize any sugar. Yun lang ibig sabihin nun. Okay. Now, to test to differentiate your Moraxella from Neisseria, your Moraxella is not so fastidious. It can grow on nutrient agar. So that's a check. It is DNase positive. Okay? It cannot, no, your Moraxella cannot utilize carbohydrates, unlike your Neisseria. Okay? And plus, it is positive for butyrate esterase reaction. Okay? So, ang DNase, na-discuss na natin ito in Staphylococcus, right? So, pareho lang. Okay? So, usually, methyl green ang ginagamit. No? So, pag may clearing, that would mean merong DNase enzyme. Now, for butyrate esterase reaction, so for this test, the bromochlorindolyl butyrate reagent is used, this will be cleaved by the enzyme butyrate esterase if present, no, and produce indoxyl and oxygen. The release of indoxyl is responsible for the indigo color production. Okay, so a positive indigo color is positive for butyrate esterase reaction. Okay, so that's all for today's discussion. Thank you guys, and God bless your entire day. Okay, bye.